Hey everybody, it's Travis and Lee. We have another webinar series for you about remote therapeutic monitoring. We're here with PT Wired. Vikram, you guys should know Vikram. If you don't, then he's going to introduce himself a little bit, and then he's going to get into the meat of this. I've challenged Vikram because I've been wanting to do RTM since he started talking to me about it. I'm embarrassed to say how long ago. And there's something going on with like a limiting belief or something where I'm like, oh man, it's like one more thing that I've got to have my therapist do, and can we implement that? So what Vikram has said is going to help me out with that today and just kind of explain everything you need to know about remote therapeutic monitoring. So enough of me talking. Vikram, go ahead.
Yeah, thanks so much, Travis and Lee, for having me on again. Super excited to chat today about how to take advantage of RTM in 2024. Yeah, like Travis said, I'm Vikram from PT Wired. PT Wired is a patient engagement and remote therapeutic monitoring solution for physical therapy clinics. We work with a lot of the NLPT group, both the NLPT founders as well as a lot of the members. So very excited to be on the call today. And for the agenda, what I'll kind of run through is, an overview of RTM and the codes. What is it? We won't spend too much time on that because I think a lot of people at this point have kind of heard of RTM and seen the codes. And I want to spend a bit more time today on breaking down how to get started, as well as what method may be the best for you, because there's a couple different ways you can do this. We'll run through the different ways that you can implement RTM, some common mistakes that we see, as well as strategic approaches based on how your clinic operates, how your staff is wired, which will determine the most success with implementing RTM. So to start, these are the four codes: the initial setup, the data transmission, and the first 20 minutes and additional 20 minutes of RTM services. And to break these down the most simply, there's patient usage-based codes and there's provider usage-based codes. So basically, there's codes that your patients can meet the eligibility for based on their usage of an RTM system, whether that's PT Wired or whatever other system is being used. And then there's provider usage-based codes, which is based on the provider's usage of an RTM system, to the amount of time and that they're spending with it. So for remote therapeutic monitoring, you have to have some type of uh, device, software as a medical device, that is being provided to the patient to be able to monitor them, collect data from them, and then ultimately bill for those services. The vast majority of the people listening to this call will already be using something that qualifies. Whatever your home exercise program system is, um, a lot of these requirements for these codes are already being met by a lot of you guys. And what's most important is how you're tracking the requirements, and then obviously billing for that. Because last thing you want to do is leave the money on the table. So with these systems that you're providing, whether it's PT Wired, whether it's another system, the codes are based on the patient's usage of the system as well as the provider's usage of the system. Um, and there's other webinars we've done where we break these codes down one by one, really, really specifically. I'm sure we can maybe link to that in the comments of this, of one of the past ones where we go through that. But I would rather spend, since a lot of people are kind of familiar with the codes to some extent at this point, I want to spend a bit more time on the strategic side as well as how to get started.
So to summarize that, Vikram, I think what I heard you say is you guys are doing this stuff already. You're just not coding for it. So it shouldn't be that much work for us to make it work.
Yeah, for a lot of the requirements. So specifically for the first two codes, if you are a clinic who is creating exercise programs, digital home programs, and assigning them to patients, you're already meeting the requirements for those two codes in a lot of cases. Um, that doesn't necessarily mean that the system you're using may be tracking those requirements. That's something that you'll need to make sure that you use a system where it either automatically tracks it or you're able to manually track it. But from a standpoint of what you're doing as a provider, you're already meeting the requirements for that. For the second two codes, a lot of you guys are meeting most of the requirements for that, because it's 20 minutes of RTM time being spent, which is basically over the course of a month, you're spending 20 minutes of time creating programs, editing programs, reviewing patient data and progress on your system. And then the one piece which most people are not doing is one live interaction, whether it's a phone call, some type of synchronous call, or synchronous interaction. Um, that's why I say, regardless of what you're doing, you should be billing those first two codes. You should be, make sure you're tracking and billing those first two codes because you're already doing the work for that. And then for the second two, we can kind of run through what's required there, and then you can make a decision on your end if that's something that is worth implementing and billing for, and if it is the best options for doing that.
Got it.
So how do I get started? This is really not as daunting as a lot of people might think, though I know PT clinics, you guys are super, super busy, and implementing anything is always a challenge. And that's why I'll run through a couple different options for how to do this. But like I said, there's different approaches, there's different codes, there's different ways of doing this, and there's not kind of a one catch all. So I'll run through some different approaches of how you can get started. And then based on how your clinic operates, based on how your clinic is structured, you can make a decision of what you think is the best approach. And we're always happy to chat through this if you want to book a time with us, whether you're already existing and haven't implemented RTM, already using PT Wired and haven't implemented versus not using PT Wired and thinking about RTM. We're happy to have a chat, let you know what types of clinics tend to do the best in which types of systems. So yeah, just you can definitely book a time for us for that. But as far as the different ways you can go about this, there's two options that we offer. One is self-service and one is full service. For self-service, that means you're managing all the RTM requirements, tracking, and billing in-house, which means on your end, you're setting up the home programs for patients, you're providing the full 20 minutes of monitoring time, you're doing those required synchronous live interactions, as well as tracking when the requirements are met and submitting those for billing. If you're going self-service, you basically have to have a system that is going to do the tracking for the requirements for you. Otherwise, the ROI is probably not going to add up because it's going to take a lot of time to really look at the requirements and make sure you're being compliant. For full service, this approach is partnering with an RTM company to assist with RTM requirements, fulfillment, and tracking. And basically what that means is it's kind of a combination of your providers doing some of the requirements and then the RTM company providing the rest of the requirements. So for example, I mentioned almost all you guys are probably creating home programs and updating programs for patients today. I think the vast majority of people are already doing that. What people are not doing in most cases is having that live call with the patients, ensuring that 20 minutes or more are met per calendar month with each patient, and checking in with patients regularly to ensure that they're meeting the usage requirements for those first two codes. So there's other things that you can take advantage of to get the most out of RTM. And that's kind of one of the things that you need to think about. When, for example, we have some clinics that they only go for two codes for patients. We have some clinics that go for all four codes. We have some clinics that, they just set up the home programs, and some patients will meet the requirements for some codes and some won't, and they're fine with that. If you're going full service, the approach there is that you're going for all of the codes for every single patient who's eligible. And basically the RTM company, so for example, if we were working with you for this, our assigned provider would be checking in with the patients, providing the services, and making sure that the requirements are being met. So what's right for you? I'll kind of break down a couple scenarios. Let's say you are a smaller clinic, you're not fully booked out, and you have some open slots, maybe you're expanding or something like that. All the time that your providers are not seeing patients, they could be generating revenue from an RTM standpoint. All that time that they don't have a booked slot, whether it's a cancellation or just an open slot that was never booked, they could be generating RTM revenue for all of the patients at the clinic. So if that's you, you should probably go with self-service because you can generate the revenue in those open slots. That gives you an opportunity to generate revenue at times when you normally wouldn't be generating revenue, and it would have basically just been an open slot. So that's one option there. Now let's imagine that you're a clinic that is fully booked out, don't have a very high cancellation rate, and the PTs are swamped. In that case, you're going to want to go full service because your physical therapist, you're not going to have the time to do the extra calls, to do ensure all the 20 minutes are met, to track all the requirements, to do the check-ins, to submit the codes, because you're kind of already busy as it is. But even in that case, if you're fully booked out and busy like that, like I said, you're doing a lot of the requirements anyways. So you might as well add on the full service element to take advantage of all of the RTM revenue. Otherwise, you're kind of leaving money on the table because your providers are doing a good portion of the work and getting none of the revenue. Um, Obviously, these are two examples on each end of the spectrum. There's a lot of nuance here, and there's certainly busy clinics which can benefit from a self-service model, and there's smaller clinics which can benefit from a full-service model. This is kind of a quick high-level view, but like I said, we're happy to hop on a call and run through different scenarios, run through different circumstances to make a recommendation to you, as well as give you more information for you to make a decision on what would be best for you guys. So for RTM strategy, we're going to break down a couple different things here. And this is for the self-service approach. So this is if you are going to manage RTM yourself. Some people, when they manage RTM themselves, they'll have a dedicated RTM provider. This is particularly going to make more sense for clinics which are a bit bigger, where rather than having to educate every single staff member on RTM, what you can do is you can have one staff member who becomes very proficient at RTM. They may have more calls with our team, training calls, they learn the codes, they learn the processes, etc. And then that RTM provider can provide all the services for all the patients across every other provider at the clinic. So for example, if you have, let's say 20 providers, you can pick one PTA, for example, who's a bit more, maybe tech savvy and, likes working from home one day a week or something like that. And then that provider can then be the pinpoint RTM person who learns the codes, learns how to provide the services, learns the billing. And that way you take advantage of all of the RTM revenue without having to disrupt your workflow for the other 19 providers. We've seen people get pretty creative with this in terms of like, if a person goes on maternity leave, but still wants to, be able to do some stuff from home that can generate some income for them. We've had them be the pinpoint RTM provider. So there's lots of different ways where you can get creative with this, but what's most advantageous about this is it's the least disruptive from the self-service standpoint, because you only have one person who needs to learn RTM, and now you're capturing revenue for all of your patients. Every single patient is going to get, at least every single RTM eligible patient is going to get the services without every single provider needing to learn RTM. I will say without a doubt, you get the best. We see the clinics with a dedicated RTM provider have the best numbers. No doubt about that. Next is
Hey,
RTM during
Vikram,
camp. Yep.
so for that strategy, is that something you guys kind of hand hold us through? I mean, just say we're doing RTM with your team, or is that you're just kind of going solo with that?
No, we hold your hand through it, absolutely. So
Yeah,
the dedicated RTM provider route is kind of the same as the full service, except the provider is on your team. So the approach is
gotcha.
kind of the same, because if it's full service, our provider is assigned to you. They do everything as one pinpoint person. For dedicated RTM, it's your provider, but they still get trained up. We'll teach them everything that they need to know to be able to do it. But then that way you capture all of the revenue.
And you might get into this,
Oh,
Vikram, but let's say we have this scenario, and it depends on volume, obviously, but could it be that you have, in the example you gave, I have one provider that just wants to work home for one day. Could they do this one day per week, or is it something you've got to do, spread it out 3 times a week, or how does it work?
They could do it one day per week. And another thing to remember is, there's, you know, let's say it is dependent on volume, obviously, and that will dictate how much time they need to allot. But even if you just pick one day a week, maybe they don't get to every single patient, but that just means you don't capture all of the revenue, and it's not like there's a massive problem with that. Um, and obviously, then you can always check the numbers and every couple of weeks readjust how much time they have dedicated to RTM. One thing I can there's a screenshot of a bit later, is how we have our reports dashboard where you can easily track the time that that person is logging. So then you can ensure that the time is matching up. But yeah, it kind of depends on the volume. That's another thing that we typically can go through on one of our setup calls in terms of running through the numbers of, all right, how many patients are you seeing? How many are RTM eligible? Which codes are you going to go after? Okay, this is how much time you're going to need for a dedicated provider. And then you can then make an assessment from there. Okay, this is how much time I need to block out.
Got it. Okay.
Perfect. Another opportunity during the self-service is RTM during cancellations or openings. I briefly touched on this earlier. Everybody gets cancellations. Obviously, some people get more than others. And rather than that being time that's lost from a revenue standpoint, you can have, if it's a 60-minute slot, you can have some type of a system where whoever it is does at least 20 minutes of RTM time during that slot, whether it's for their patients or other patients. This can go along with the RTM provider, the dedicated RTM provider, because it's just more time, which means more money. It's not like you can't have this with the other one. And then that way you're at least generating some revenue during a time where you would normally not. So for example, if we do one code, the 98980, which is 20 minutes. So if you just say, if you have one cancellation, you do at least 20 minutes during that 60-minute cancellation slot. There's $50 right there that provider is going to generate during a time where they would normally generate nothing. So that's something that regardless of the strategy, you can always have some type of incorporation there for the cancellations. Next, the way that you position this to patients is very important. If you describe this exercise program, this app as a monitoring tool versus an instructional tool, that's where we've seen the best results from a usage standpoint. If patients view it as an instructional tool, then once they learn the exercises, they'll kind of, not necessarily go in to check it off every single time. Whereas if they view it as a monitoring tool where a provider is actually tracking their progress, actually looking at how they're responding and any feedback that they're giving, then they're more likely to engage. And the more engagement that we get on the app, the more that we can bill, because some of the codes are based on the patient's engagement on the system. They have to actually use it to a certain extent for us to be able to bill the codes. And that's the highest paying code as well. All right, some common mistakes here. First, we see that sometimes there's a big gap between eligible RTM patients and enrolled RTM patients. This is actually probably the biggest issue that we see. Let's say you have 100 Medicare patients, and we look on PT Wired and only 25 are labeled as an RTM patient and set up. This is something which comes down to educating the staff in terms of knowing which patients to actually enroll in RTM and providing some checks for this. The way that we address this, and it's best if you use a system where you can do a report from your EMR, so you can see, okay, how many active Medicare or and whatever other payers you've got that are reimbursing RTM, how many active patients do I have in that bucket? Then do a report in PT Wired and see, okay, how many active RTM patients are in PT Wired, and compare those numbers. If there's a big gap there, then you're leaving a lot of money on the table. The next is a big gap between eligible RTM codes and submitted RTM codes. This is probably the worst mistake, because you do all the work, you meet the requirements for the code, and then it doesn't get submitted for whatever reason. So for that, you should be able to get a report of what you've actually coded. For example, I know a lot of people in NLPT use Prompt. Prompt has a RTM charges report where you can just quickly see what you submitted over a certain date range. And then you could do the same report in PT Wired to see what you were eligible to submit over that same day range and make sure those line up. Because again, the worst thing that you want is, you do all the work, you're eligible to submit the code, and it just doesn't get coded. The last thing is billing issues. I'm going to go through a couple ones here because this is actually a little bit complicated. RTM is obviously for remote therapeutic monitoring, which is services provided in between visits. But the way that most systems work for billing is you have to bill these codes as part of visits. And this can create some complications because let's say today you meet the requirement for a code, a 30-day code, and you're eligible to submit this today, but then the patient isn't coming in today. So you don't have a visit to assign that to today. You have a couple options then. You can apply it to the next visit that the patient comes in. You can apply it to a previous visit as an addendum, or you can create a quote unquote RTM visit to submit it to. And all of these methods have their advantages and disadvantages, and it can depend on who the payer is. It can depend on the rules. And these are the things that are important to keep in mind here is how this can impact whether these are denied or not. For example, codes 98980 and 98981 are billed per calendar month. Let's say it's January, or in this example, let's say it's like March 3rd and you meet requirements for 98980. If I add that to a previous visit, which is in February, then that will interfere with the one that was added in February and it'll get denied. So these are the types of things which you really need a system which will keep track of this for you. The same idea as with the 30-day billing code 98977. If I meet that requirement today, but then I add it to the most recent visit, which was yesterday, that may interfere with the previous 30-day period for the last 98977 that I billed, and it'll get denied. So there's more thinking that's involved here, and going with the full service route can kind of take that off of the plate of whoever's managing RTM. But if you're managing it internally, you still need to then get that person, whether it's a dedicated RTM person or the whole team, up to speed on some of these billing items, because again, you don't want to get denied after doing all the work. So a little bit about PT Wired for those who are unfamiliar. PT Wired is a patient engagement solution and physical therapy and remote therapeutic monitoring solution for PT. Everything is 100% custom branded. Every clinic gets their own mobile app. So for example, you could search Robin's Rehabilitation and find Travis's app. You can search Spa City and find Lee's app in the App Store. Everything is custom branded. The patient never sees the PT Wired name. So in addition to getting an RTM system, you get your own custom branded app for iOS and Android. And everything is to give the idea to the patient that this is something the clinic built, this is something that the clinic made. So it's a full continuity of brand, whether they're in the clinic or out of the clinic. Everything is Robin's Rehab, for example. We have a therapist portal where you're able to build the exercise programs, 7,000 plus exercise videos. You can upload your own videos, templates, favorites, filters, smart search, and export as a PDF as you want as well. Our system automatically has RTM time tracking. So if you're managing the services yourself, we will track the time for you automatically to make sure that you're meeting the requirements there. And as far as RTM requirements go, our dashboard tracks the code requirements and bill dates for all patients, and then gives you notifications when a patient is eligible to be billed. So you'll get an email saying you have a new code that's eligible to be billed. You can go in, see what that code is, and then finally get the documentation you need to bill it. That's for when patients actually meet the requirements. We also can give you status reports on how patients are progressing in the middle of billing cycles. So then you know if somebody is on track, if they're not on track. So then that way you can kind of adjust your engagement accordingly to make sure that you're maximizing your revenue. And yeah, finally, like I said, will automatically prep the supporting documentation that you need for billing. This is a quick view of the RTM dashboard. Obviously, there's a lot more to this that we can break down for you if you're interested in hopping on board. We can hop on a call and get through everything with you. But you can see that we break it down by who's ready for billing, who's on track, who's not on track, and who's no activity reported. And then at the bottom left, you can see that all of the time that you're spending is automatically tracked for that 98980 and 98981 codes. Finally, on the report side, you're able to see from a macro level how many codes you've been billing, which providers have been billing which codes, how many total active RTM patients you have, so you can easily compare that to how many you should have, how much time is being spent and stored by each provider. So I can see, for example, here, which providers are generating the most RTM time and revenue. We've had people get pretty creative with this as well for, some people even giving bonuses to their staff based on the amount of RTM codes that they're generating. So there's a lot of different ways you can approach this. But specifically for this RTM service time tracking, for those of you who are considering having one dedicated RTM person, this way you can easily see, okay, if this person's at home every Friday to do RTM, they better have X number of hours stored in the system, and you can make sure that that's actually the case as well for the tracking standpoint to make sure that the ROI is adding up. Another thing that we recommend is if you do have a pinpoint RTM person, one of the things that we do is we prep these little postcards, which you can hand to the patient so then they know they're going to get a call from this pinpoint RTM person. This is who it is. This is the number they're going to be calling from. This is what they'll be explaining, etc. So then they can actually expect that. And then that way also to minimize as much disruption on the staff as possible. So then the staff doesn't need to know, okay, who's going to be calling? What's the number? What are they going to be telling them? They just give them the postcard, or even the front desk can give them the postcard. And then that way the patient knows what to expect. All right, so yeah, that's a lot. I know I was kind of going fast there, but you can scan that little QR code at the bottom right if you want to book a call with us. And like I said, we're happy to be a resource, whether it's for us or any other system that you may be using in terms of how to implement RTM. Just book a time with us. We're happy to chat.
All right. So while people are looking at that, what are the biggest, most common fail points? Like I'm sure just like with patients, no matter what we do as clinicians, sometimes it just doesn't work out. So the practices where it doesn't work out, what are the things that you can point to be like, well, they didn't have this in place, or they didn't understand that they had to do this? Like, where do they fall apart?
Yeah, the biggest thing is that enrollment versus eligible patients, where the staff just does not enroll the patients into RTM for whatever reason. That's a training thing. So then obviously if the patients aren't being tracked, then they're not going to get any revenue. They're not going to generate any code. So the number one thing is to make sure that everybody who is eligible for RTM is actually getting flagged as an RTM patient in the system. After that, I would say the main issue is on the billing side. Like I mentioned, there's a lot of things that are, could complicate things from a billing standpoint in terms of which visit it needs to be added to, how this can depend if it's a Medicare patient versus a patient with a commercial insurance who pays for RTM. There can be a lot of differences in how the billing needs to be done. So that's another thing, which is training related. And ideally, if it's one person who's managing RTM, then they can work really closely with us. We can make sure that they know how to do the billing, they know how to do the tracking from the enrollments to ensure that those issues don't pop up.
All right, let's talk about eligibility. So what patients you keep saying eligibility. So let's talk about who's eligible.
Yeah, so all Medicare and Medicare Advantage plans will pay for RTM. So those should
Everybody,
all
no
be
matter
set
what.
up. Yeah, they
Okay.
should. I mean, all Medicare Advantage plans are required to pay for Medicare, and then Medicare, obviously introduce these codes.
Okay.
From there, it depends on the state. It depends on the plans. We've had people see payments from Aetna, from UHC, and from Blue Cross. Blue Cross, I would say, can be the most dependent on the state. Not all Blue Cross plans are paying, and some are. Some require authorization. So there's a bit of nuance there. And again, if you book a call with us, we have a big master spreadsheet where we have all the reports of what we've heard for each state with each plan that we have. So we can tell you what we know. But at some point, sometimes it just comes down to billing the codes with the patient, seeing if you get paid, and then if you do, keep billing them, and if you don't, then don't. But obviously, yeah, every Medicare Advantage patient, go ahead and set them up.
And so the reimbursement rates that you showed on the slide, that was for Medicare. And
That's for Medicare. Yep.
yeah,
But
did they change for commercial?
very slightly. We've never seen it change significantly.
Oh,
But yeah, it's not going to be exactly the same. But for the most part, we've seen those be pretty similar to the Medicare rates.
yeah. Some of those codes pay more than a visit for some of the providers that you said, depending on the state. So that's that's good news.
And then
So yeah, go ahead, Vic. I'm sorry.
I was just going to say, obviously, you could go to, if you know your MAC locality, you can search the exact rates. Those ones that I listed are the national averages. So it could be a bit higher, could be a bit lower, depending on where you are.
Okay. Now let's talk to something that people might be concerned about. What's the patient's responsibility? Like they have to be able to participate. So they, when the system falls apart on the patient end, what is the patient not doing?
Right. So if the patient doesn't set up their account and use the app, then obviously we're not going to be able to build the setup code or the data transmission codes. Um, that doesn't mean that you can't get revenue from the other codes. So if you're still providing the other services, you can still get revenue from those codes. But obviously, we want to maximize the revenue, so we want to make sure that we hit the patient usage requirements. For the setup code, you need to make sure that they activate their account, download the app. And for the data transmission code, we need 16 days of data points over a 30-day period, which means we need to collect some type of data over a 30-day period 16 times. That could be an exercise completion. That could be a message, like an outcome rating. But one way that we make this much, much easier to hit is we get the patient's step count per day. That way we don't have to get them to actually log in and do something every single day. We can actually get data from them on days where they're not actually opening the app. So maybe they do their exercises 10 days out of the 30 days and we get their step count another 8 days. So it makes it a bit easier to beat the requirements, but they still need to engage to some extent. Obviously, if they never download the app, never use it, then we're gonna be leaving some of the money on the table. So what we recommend before the patient leaves the clinic, have them download the app, log in, and activate their step tracking. If we can get those three things, the amount of patients that will meet those first two codes goes way up. We have, one of the things we do is we provide these flyers that people keep on the front desk that they can scan the QR code and kind of get set up. But yeah, if we can get them set up before they leave the clinic, our chances of getting those first two codes go way, way up.
Okay. And this might be kind of similar to the question I asked about the practices that are not doing well. What are they kind of missing out on? The practices that are doing really well, what do they have in place? So if I'm a practice owner, I'm like, yeah, this sounds like a good idea, but what do I need to have in place for this to be successful?
Yeah. First thing is the dedicated RTM provider. Having one person who's just on it, they know the codes, they know the processes, they're doing checks on a regular basis, and they're making sure that no code that is eligible to be submitted is encoded. That's one of the main things. After that, they're setting everybody up who's eligible, and then they're also going for all of the codes. I mentioned that depending on your clinic, depending on how you operate, you can just go for some codes, you can go for all 4 codes. Obviously, the people who are making the most money are going for all 4 codes. So if you go for all 4 codes, then you're going to be able to generate more revenue. Aside from that, I think it kind of comes down to the buy-in from the staff. Ideally, with a dedicated RTM provider, there's very little that the staff needs to do differently. The only thing that they need to do differently is enable RTM if it's an RTM patient. But then also, obviously, they have to use the system. They have to set up exercises on that system. So if that's not happening, then obviously, all of the patients who are seeing that provider, we're not going to get their revenue as well.
You said data points. I think you said something about collecting like a steps per day.
Yep.
So that could be if they just record their steps every day for 16 days, does that become like eligible for that month?
Yeah, it would. And what we need, they don't actually need to record it. They just need, once they have the app, and as long as they've enabled the access to step tracking, which is what we ask them right as soon as they download it, and as long as they have the app running in the background, we'll get their steps automatically every day, which is how it makes it much, much easier to hit that requirement. So yeah, then, like I said, if a patient has their step tracking access enabled, then they may only need to do they may only do their exercises a couple times that month in the app. We get their steps on the other days, and we can still bill for that code.
Okay. Are there any other besides the exercises? Therapists tend to struggle to get their patients to do their exercises, their steps. Are there any other data points that if they're struggling, oh man, I just keep forgetting to do my home exercises? What are other data points that qualify?
Yeah, so the main one that we're about to release an update to the app, which is going to include a daily outcome score, where it's just a how are you feeling every day, that they get a notification in the morning, just like log how you're feeling for the day. And then that also counts as a data point.
So tough question. Don't mean to put you on the spot, but have you seen anything with improvement in plan of care compliance? So it seems to me if a patient is more engaged, they're, making physical therapy a little bit more of a focus. So one of the big things that we teach is that if you really want to improve your practice, improving your successful graduation is one of the things that we focus on. Getting someone from an initial evaluation all the way to a successful outcome at the end of a plan of care. Do you guys have any data on, the patients that are engaged and use this stuff actually have better outcomes? Because I see that as a way to sell it to the clinicians. in terms of, hey, this, clinicians are maybe not necessarily focused on, okay, we get more revenue per visit, so that just helps out the owner. That's not super exciting to me, but if I can improve the quality of care that I'm giving, now I'm bought in.
Yeah, yeah. I mean, that's why these codes exist in the first place, actually, is because the data shows that patients who use these types of systems and have this type of engagement in between visits are better, they have better chances of meeting their outcome goals as well as not dropping out. Obviously, we know 70% of patients don't actually get to discharge. They drop out before, 20% drop out in the first 3 visits. And that's why these codes exist, because the number one indicator for a patient who's likely to drop out is if a patient's not doing their home exercise program. And then that's when they're more likely to disengage, is in between those clinic visits. So yeah, that's, a lot of clinics, obviously, when they look at implementing RTM, the main metrics that they're looking at is how much money am I making from RTM? But another thing I would encourage you to look at is, after you implement a system like this, with that dedicated RTM provider and everything, look at how your average visit count per patient changes. Look at how your dropout rate changes, because that's ultimately why these codes exist in the first place, and why these payers are reimbursing for these codes, is because of how the data is linked there.
Yeah, that makes sense. Lee, you got anything?
Yeah, I got a question. So we have multi clinics. We got like 5 clinics. So how does that process of having, like, if we're doing the having one dedicated staff member, is that a barrier, or have you seen that the strategies there work okay?
It works fine. The only thing to consider is if I remember correctly, some of your clinics are in different states. Is that right, Lee?
No, mine are all
Oh,
kind of within like a 30 or 40 mile. Yeah, we're all in
okay,
the same
perfect.
state.
Perfect. Yeah. So then
That's
no issues at
Jeremy.
all. That's Jeremy.
Okay.
Gotcha.
Yeah.
Yeah. If they're all in the same state, as long as the person you have is licensed in that state, they can provide services for all of the patients. And you know, every now and then there's some kind of supervision requirements which are a little tricky in some states. It's very uncommon, but it does happen. For example, in Oklahoma, they have a requirement where the supervision requirement, if it's a PTA, needs to meet with be in the clinic once every 3 months, or some kind of
Mm.
specific thing. So just make sure you check your supervision requirements. That's pretty unlikely, because it's most states it's pretty straightforward. But yeah, as long as the provider is licensed in the state, and then yeah, there's no issues there. Obviously, if it were somebody like Jeremy, they would need to be licensed in both states if they're providing
Yeah.
for the patients in both states.
Gotcha. Okay. And then one follow up. So if you have the one staff member, and I actually have one that just reached out to me. She's wanting to cut back hours. So I'm like this may be a great opportunity for her to kind of take the lead on this. As far as the billing side of it, would that same person do the billing, or would it be someone within our team? We use Prompt, so I'm just kind of curious just on the logistics of how all that works.
Yeah, usually it would be that person. That's what we would recommend.
Okay.
I think that's that I mean, we have people who've done both, where they still have their providers actually track the code submissions and all that. We see the most success where it's just that one person, because then they learn all of the nuances of how to bill, and then we teach them all of that, and then we make sure there's no denials.
So the individual clinicians are not changing anything. If you have a dedicated teammate to kind of focus on, they're just still handing out the home exercise programs. It's just someone else is externally monitoring it. They're also externally billing it. So it's not something that every treating clinician has to bill, correct?
Correct. The only thing that they need to do is, when they add them, there's a toggle that says enable RTM. And then that's the only difference from, what they're doing right now for you guys.
Okay. It seems like an easier sell. Yeah. Lee, anything
I need to get
else?
on that call with you, man. No, I'm good. I just need to. I mean, we have a pretty high concentration of Medicare, so it's kind of a no-brainer to us to be doing this.
Yeah. Okay, last
Um,
question. I
so
know this is again tough thing to say, but in the effort to kind of motivate some clinicians to be like, okay, this is probably something I should do. What is expected revenue? And I know there's a million variables. You've got to have people. Let's say it goes well. Someone that can implement it, do all the things that you said, avoid all the things that you said not to do? What are typical revenue expectations, however you measure it by week or by month, based on how whatever number of visits per week you want to use as an example?
Sure. So, when we do our demo calls, we have a calculator where we get all the numbers like the payer mix, and then run through scenarios about, okay, what if only 20% of your patients use the app? What if 80% use the app? How do those numbers look? What if you have the other thing to remember is, for some of the codes, if the dedicated RTM person is a PTA, the modifier will apply the 15% reduction. So all these things we can get very specific to give you a more accurate estimate. Right now, that what I could tell you is that if you implement it, and you build those first 3 codes, so not the 4th code, because that's a bit less common that somebody bills 40 minutes, but if you build the first 3, that's $125 per patient per month, from implementing RTM. So then you can kind of multiply that by how many active patients you're seeing, and then times that by a percentage of how many you think would use the app to get a somewhat general idea. But yeah, like I said, we have a calculator. We can get a bit more specific from there, if you book a time with us.
Yeah, so that gives people an idea. And then if you want more specific numbers, then just use this QR code to get a call at Vikram. Sounds good.
Mhm.
Vikram, thanks for your time today.
Sweet.
Hopefully we have convinced some clinicians that have been kind of on the fence with RTM. I mean, it's been around for a while, so it's certainly going to help me. I, in the middle of this call, was texting a clinician who's been asking me, hey, can I do some stuff outside of my treatment hours and kind of move away? I mean, we've seen a ton of that. I mean, I still love physical therapy. I don't treat full time, or really at all anymore, so I have that advantage. It always kind of like, I've got younger clinicians that are feeling like they're burnout, like in their like second or third year of being a PT, which is concerning in a whole nother webinar. But this can be a valve for someone that is like, hey, just kind of separating a little bit of their week and doing just something different than grinding out patient visits can be helpful, and give people an idea in terms of how they can solve that problem and add some extra revenue. And for me, like the biggest thing I heard was like improving plan of care compliance. Like if you're not graduating 80 to 90% of your initial evaluations that are coming in successfully, this tool, I think, could have a huge impact on that in just terms of engagement, and in just really just separating yourself from other people in your area that are not doing these kinds of things. They have an own individual app. We're tracking, we keep an eye on what's going on. And people get like impressed by that. It's like, wow, I've been to physical therapy other places. They don't do this stuff. So there's a ton of positives to implementing this. It's just kind of getting over the hurdle of picking a way to do it. And the easiest way to do that is just getting a call with Vikram. Use this QR code to set up a call. He can go over all the nuances and things that you need to do to make a decision that's best for your practice. So yeah, Vikram, thanks for your time today. And as always, guys, we'll see you at the top.
Yep. Thanks, guys.
Thanks, Baker.